In the video of arrhythmias and ectopic ventricular beats, we first started the idea of a premature ventricular contraction. And so that's where we're going to pick up here. Now, hopefully you remember then, a premature ventricular contraction is when somewhere in the ventricles, the heart cells depolarize before the SA node depolarize. And so you get this wide, strange, early beat. Here it would look like this. So there's no P wave, it's early, the QRS complex is wide, you have a T wave in the opposite direction. So you have a PVC. And what this is really going to do, because it beats a little early, the ventricles aren't completely full, and so you get a reduction in blood flow. Now, what will happen is people might have these relatively regularly. So what about this case? So here we have a normal beat, we have a PVC, we have another normal beat, and a PVC. And so this individual is having PVCs every other beat. So if every second beat is a PVC, we give it a particular name. We call that bigeminy, ventricular bigeminy. All right, so that's ventricular bigeminy. Now it could come a little less often. It could be every third beat. If it's every third beat, I should write every in there, then we call that ventricular trigeminy. It's generated every third beat. You could also see it every fourth beat perhaps, which would be a little bit better. The more often, the worse it is. And so this would be quadrigeminy. Right, so PVCs, they can become fairly common. Okay, bigeminy be the worst of the three here. All right, but that's not all. You may have on occasion where somebody has a normal beat, then a PVC, right into another PVC, and then they go right and back into their normal rhythm. Now, when you have two PVCs, so here's one PVC, here's the other PVC there, two PVCs back to back, we call that a couplet. It's like a couple. It's a couplet. Now, that's worse than the others because now the PVCs are more and more often, which means an even larger reduction in blood flow, which means the heart myocardium or the myocardium may become more ischemic, which makes them more irritated, which could cause additional arrhythmias. So what happens if you see three PVCs in a row? We call that a triplet. We also have other names for three PVCs. Once you hit three PVCs in a row, we may call that ventricular salvo. But more importantly, we have finally hit the criteria for ventricular tachycardia. So we'll come back to the idea of ventricular tachycardia. But the next thing I want to point out, if we scroll back up here, is when you look at the PVCs I've drawn, so this PVC and this PVC, what do you notice? You notice that they look exactly the same. And so the chances are they came from the very same site in the ventricle, and that's why they look the same. So if they look the same, you might call them unifocal. Unifocal PVCs. Uni means one. Focal refers to what's called as a focus or a site within the heart tissue. So remember we talked about an ectopic site it's a area outside the SA node. Well, you could also call it an ectopic focus. Remember, it's not the SA node. So unifocal means there's one focus. There's one site in the ventricles that's causing these PVCs. So if the PVCs look the same, the chances are it's the same site in the ventricles causing an issue. So unifocal PVCs, they all look the same. So let's scroll down here. I had a couplet here, so two PVCs back to back. They look a lot alike. So these would also be considered unifocal. One focus. There's one site that's giving us an issue. Now, what would be another option? Well, let's consider this scenario. Well, let's try and catch everything that I'm doing here. Okay, what's going on here? Well, the first thing you want to realize is, hey, look, here is, let's try this again. You may have noticed that we have a normal heartbeat here, and then a PVC, and a normal heartbeat and a PVC. Normal heartbeat, PVC, normal heartbeat, PVC. And so there's a PVC every second beat. And so the first thing we've noticed here is we have ventricular bigeminy. Okay, that should be an I. Yes. Now, what's the next thing you notice? Well, these PVCs do not all look alike. R wave is upright, T wave opposite direction. R wave, or it's actually a QS wave, so you have a negative QRS complex, T wave in the upright direction, a positive QRS. So these PVCs do not look the same. So if they don't look the same, there must be more than one focus. And so more than one, we say, is multifocal. More than one focus. So up here we had unifocal. They're probably from the same site because they look alike. Down here, they don't look alike, so it's probably more than one site in the ventricles giving us an issue. So you'll have unifocal, multifocal, as well as you need to recognize, is there bigeminy, trigeminy, quadrigeminy, or is this just one single isolated PVC? Now the other thing you probably noticed when you saw this PVC is what's called a compensatory pause. So if you look here, our normal rhythm right here, so here's our regular rhythm. There's a QRS complex here. There should have been one here, but instead we had a PVC. So the PVC came in early, but then we finally get back on our rhythm. So because we had a PVC, we have this kind of pause here, this longer than normal pause. See, the distance between one cardiac cycle and the other is a little bit shorter than what we have here. So this is a little bit of a longer pause than normal. It's because the PVC came in early, plus it allows time for the SA node to kick back in. And so usually when you have a PVC, you have what's called a compensatory pause. A pause to help compensate and let the SA node take over again as the pacemaker. And then you're fine. So that's called a compensatory pause. Now, what is your other option? Well, let's see. What is the other option that we might have here? Well, it might look like this. So I'm trying to follow the same pattern as the ECG I just drew above in green. Okay, so you see the pattern. What is the distance between R waves here? So this is our normal rhythm. And guess what? The heart maintains that normal rhythm. Even though there's a PVC sandwiched in here, the heart maintained its normal rhythm and still had a QRS complex every time it needed one. So in this case, there is no compensatory pause. So here was our compensatory pause. Here there's not. The heart was able to maintain its normal rate. And so what we do is we call this an interpolated PVC. A PVC that's sandwiched in between beats. No pause occurs. And so you may see that from time to time. All right. Now what we need to do, though, is we need to come back to this idea of ventricular tachycardia. Now, hopefully you remember that tachycardia means the heart rate is greater than 100 beats per minute. So if the heart, if the heart rate is greater than 100 beats per minute, That's considered a tachycardia. Ventricular tachycardia would then mean that the ventricles are taking over. The ventricles are the pacemaker, not the SA node, and the rate is greater than 100. And so, if the ventricles are the pacemaker, it's essentially a PVC. So what you have here is a PVC right here, and that site in the ventricles, it continues to depolarize very quickly, and so it depolarizes again, and so that site in the ventricles depolarizes again, and so I just drew PVC after PVC, and that is ventricular tachycardia. It's just a bunch of PVCs back to back at a very high rate. And so what's happening here? If the ventricles are contracting, this site in the ventricle is depolarizing at a very high rate. It's never letting the ventricles fill with blood. And so during ventricular tachycardia, you lose cardiac output. Your cardiac output drops significantly. Eventually, you'll pass out. You'll definitely feel lightheaded. You'll probably pass out. And you're going to be at a highly reduced blood flow and probably need an AED, some sort of defibrillator to bring the rhythm back. So ventricular tachycardia is not a good thing. Now, very much related to that, instead of this one cell depolarizing, what if multiple cells get irritated and all of them are trying to depolarize inside the ventricles? And so if you have a lot of cells depolarizing within the ventricles, the ECG can only pick up the sum of all that electrical activity. And so if you have arrows going every which direction, the electrical activity going this direction, that direction, what will that look like on your electrocardiogram? Here's your electrocardiogram printout. It looks like gibberish. It looks like nothing. When multiple sites, when you have multiple sites in the ventricle trying to depolarize at the same time, the ventricles essentially are quivering. They're not pumping. There is no pumping going on. They are quivering. It looks like a bag of worms. My pen would continue to work as I would wish it would. A bag of worms is what it looks like. There's no cardiac output. You've essentially lost blood flow. This is called ventricular fibrillation. Would certainly need defibrillation, an AED. Okay, defibrillation. We need to get you out of this particular rhythm. Now, one more that you should know about. Should this continue and the heart essentially dies and there is no electrical activity, no electrical activity on the ECG is a flat line. If you see a flat line and this person truly is unconscious and not moving, we call that asystole. And you probably know that A means no and systole is contraction. There is no contraction. Asystole is when there's a flat line and no electrical activity whatsoever. Right? So that wraps it up for the ectopic ventricular arrhythmias.